National Resource Center for Patient-Family-Centered Medical Home podcast, Multidisciplinary Care Coordination Training for Children with Medical Complexity, the Arizona Experience. My name is Jamie Jones, and I'm the manager of the National Resource Center for Patient-Family-Centered Medical Home. The National Resource Center is a cooperative agreement between the American Academy of Pediatrics and the Maternal and Child Health Bureau in the Health Resources and Services Administration. The National Resource Center is a national technical assistance center which aims to strengthen the systems of services for children and youth with special health care needs and their families through implementation of the medical home model of care. Before I introduce our guests, I want to provide some background about this podcast and our care coordination efforts. In 2014, the AAP published a policy statement titled Patient and Family-Centered Care Coordination, a Framework for Children and Youth Across Multiple Systems. The policy serves as the foundation for numerous care coordination activities implemented by the AAP Medical Home Team. Since the publication of the Care Coordination Policy Statement, the Academy has collaborated with the National Center for Care Coordination Technical Assistance, housed at Boston Children's Hospital, to revise and publish the Pediatric Care Coordination Curriculum, Second Edition. I am pleased to introduce Dr. Richard Antonelli and Ashley Bach from the National Center for Care Coordination Technical Assistance to today's podcast. Dr. Antonelli and Ashley have been leading efforts to revise the curriculum, and in just a few moments, we will hear a little more about the curriculum from them. Additionally, during our podcast today, we will hear from a multidisciplinary team in Arizona that adapted and implemented the curriculum to enhance care coordination for children with medical complexity. The Arizona Experience provides an example of how a public health program can collaborate with families and the clinical community to facilitate care coordination as a function of the medical home. By the end of this podcast, listeners will be able to first describe any prior knowledge and/or resources that are needed for a training on care coordination. Second, discuss how to put together a care coordination training. And finally, identify possible challenges and solutions, practices, or programs can use to replicate similar care coordination efforts. To begin, let's hear a bit from Dr. Antonelli and Ashley Bach about the curriculum. Dr. Antonelli and Ashley, welcome. Can you first share a little bit about yourselves and your roles with respect to curriculum development?
Yes, thank you very much. This is Dr. Richard Antonelli. I'm honored to be invited to participate in this discussion today. I'm a general pediatrician. I see patients at Boston Children's Hospital. Have been a long-standing proponent of the medical home model of care. The work of putting together the second edition of the care coordination curriculum has provided tremendous opportunity to bring together stakeholders and participants from across the spectrum of health. We'll be talking a little bit about them as this conversation progresses. But essentially, the curriculum is designed to bring together all important members of the care team for children and youth with special health care needs. And Ashley, why don't you go ahead and introduce yourself?
Sure. Hi, everyone. My name is Ashley Bach, and I'm a project coordinator at Boston Children's Hospital, also working closely with Dr. Antonelli on the development of the Pediatric Care Coordination Curriculum, Second Edition. And I'm also a part of the National Center for Care Coordination Technical Assistance Team. Finally, I'm also a medical student at UCSF, interested in pursuing a career focused on serving children and youth with special healthcare needs, so very excited to be part of this work.
Great. Thank you both so much for joining us today. In regards to the curriculum, it would be great to learn and hear more about it from you, including what are its goals and objectives, who is the target audience, and what are some of the key stakeholders for implementing the curriculum?
Thank you. As I mentioned, it is a known fact, and we've embedded this in that same policy statement from the American Academy of Pediatrics on Care Coordination. That care coordination is a team sport, and at the center of that team are the children, youth, and their families. And it really is, the curriculum is designed to be a tool that brings each of those participants together to define a common language, a common set of goals that guides working across these various disciplines, various settings across a community, that opens channels of communication in a measurable way between traditional medical providers and non-medical providers, such as early intervention, early childhood programs, school programs, and educational and recreational opportunities across an entire community. And so the goals and objectives of this curriculum is to formulate an approach to working interprofessionally with families guiding the way and defining their respective priorities for the outcomes of the well-being of their children and youth. And then Ashley, you proceed a little bit now, please.
Sure. So I'll talk a little bit about the target audience for the curriculum. This curriculum, as Dr. Antonelli mentioned, is designed for a very multidisciplinary audience, and it aims to organize this interprofessional learning by bringing together, of course, patients and families, nurses, social workers, community health workers, medical, surgical, and behavioral health professionals, commercial and public insurers, including Medicaid, as well as Title V programs, and of course the trainees in each respective discipline.
Great, thank you.
Yeah,
oh, sorry.
And then I was going to say, and then I'll wrap this up by basically emphasizing this notion of in the multiple states with whom we've worked with the first edition of the care coordination curriculum, we've made a point of engaging each of the stakeholders that Ashley just outlined. And it's different from state to state. In some states, the family group has led the way. In other states, it's been a Title V program. In other states, we've been able to engage with even commercial payers, with provider communities. And so the idea of stakeholders is essential in assuring the successful implementation of the curriculum, but more importantly, of the activities of care coordination to help optimize outcomes for children with special health care needs.
Great. Thank you both so much for your insights. The curriculum is housed on the National Resource Center website at www.medicalhomeinfo.org. I'm now thrilled to introduce our guest speakers from Arizona, Dawn Bailey, Wendy Bernatovich, and Catherine Lewandowski. Dawn, Wendy, and Kathy, welcome. And please tell us a bit about yourselves and what role you play with respect to systems of care for children with medical complexity.
Thank you. Sorry, go ahead, Dawn. Sorry, Wendy. Thank you so much. Yes, my name is Dawn Bailey, and in addition to being a mom to a daughter with medical complexity, I serve as the Family Engagement Specialist and AMCHIP Family Delegate for our Arizona Maternal and Children Health Title V program with our Office for Children with Special Health Care Needs.
Thank you, Dawn. And thank you for inviting us to this conversation. We're very excited to be part of this movement to improve care coordination for children with medical complexity. This is Wendy Bernatovich. I'm a pediatrician who has an interest in children with medical complexity, and I'm the Division Chief of Ambulatory Pediatrics at Phoenix Children's Hospital, as well as board certified in palliative care and hospice medicine.
And hi, this is Kathy Lewandowski. I'm the office chief at the Arizona Department of Health Services, and I manage and oversee the Office for Children with Special Health Care Needs in our Bureau of Women and Children's Health, and we receive the Title V grant funds and administer them for Arizona.
Great. Thank you all so much for joining us today. Let's talk about how you implemented the curriculum in Arizona. And to begin, I'd like to ask, how did you determine which modules within the curriculum were most appropriate for you, your partners, and the populations you serve?
Hi, well, this is Wendy Bernatovich again from Phoenix Children's Hospital. I'll start by saying that we actually started this conversation in 2014. We have a complex care clinic here, and we'd identified that care coordinating for children with medical complexity was really quite challenging, and we wanted to really improve the process. So we actually identified many key stakeholders and started kind of roundtable discussions to identify pain points. We actually then realized after having those discussions and having families at the table that it was really super important to continue this discussion. And so we were actually able to secure some grant funding to allow us to go around the state of Arizona to identify pain points. So we're here in Phoenix, Arizona, but we actually went to Tucson, Yuma, and Flagstaff. And we're able to have these meetings to identify sort of where were the issues with care coordination for children with medical complexity. And we actually identified many common themes. So some of the themes were communication issues, technology, collaboration, and family engagement was key. So it turns out that when we were looking at the modules, we found that working with family engagement was so important, and that's where we decided to start with Module 1, and we're going to move on to Module 2, which will come later in the discussion, but we wanted to start at the beginning. So that's sort of how we kind of discussed or decided to start with these modules.
Great, thanks so much for sharing. How did the National Center for Care Coordination Technical Assistance team assist you in adapting content from the curriculum to meet the needs of your diverse stakeholders?
So this is Kathy. I think that what they did for us was just really get us organized or help us to be organized. They introduced the common framework, the language, the set of tools. They just provided a lot of guidance on how to create a learning community in Arizona. And then they would hold meetings with us regularly to talk about the curriculum, how we could adapt it. They really supported us, encouraged us in our efforts to begin this work of a really great learning community.
Great, thanks, Kathy. In keeping with this spirit, what steps did you take to organize the curriculum training?
So again, this is Wendy Bernatovich from Phoenix Children's Hospital. Since we had already been sort of going around the state and having discussions, we were already connected. I was connected with Dawn for family representation and Kathy, and we would have meetings to discuss, okay, if we're going to do this modules, how do we want to approach this and how do we want to make the best use of everybody's time? We decided that two things were really important. One was identifying key stakeholders. So who were the people in the state of Arizona that were really important to have at the table? And we decided families have to be present in every conversation. Home health was very important. DME providers, clinical providers, so physicians, MAs, nurses, school was very important, and then of course behavioral health. So identifying those key stakeholders and personally reaching out to them was super important. And then we identified cases, too, that were really specific to the issues that we deal with on a daily basis here in Arizona. And that really sort of helped us figure out how we were going to approach presenting the module to our stakeholders.
Great, thanks so much. I'm going to bring it back a little bit to family engagement, which we had touched on a little bit previously. Dawn, it's so great to know that as a family member, you were so intimately involved in the planning and implementing of this training from the very beginning. How else were families engaged in this training?
Yes, thank you so much. So with keeping the idea around the real case studies, as Dr. Wendy had mentioned, we felt that it was really important to try to engage some of the families from her clinic that we knew experienced some of those pain points and areas, and some of whom were already trained as family advisors through our Office for Children with Special Health Care Needs contract with our family-to-family. And so we were very intentional about matching them with our targeted groups at the training based on their ability to have that firsthand experience with those specific pain points, so that their perspective from the family and the patient could really be at the forefront of those conversations, and as we work towards thinking about using the tools towards solutions. And then we made a really big effort to reach out to them prior to the training so that we could discuss the process ahead of time and help them be able to come prepared and feel comfortable so that they could really be an active and important participant in our small group work.
Great, thank you so much. Now to shift the focus a bit back to Title V, Kathy, as the Children and Youth with Special Healthcare Needs Director in Arizona, can you tell us a little bit about Title V involvement in the training and how this work supported or enhanced national performance measures that have been selected by Arizona?
Sure. What we provided was we hosted the in-person training. We provided some of the funding. We coordinated the logistics portion of the training with printing of the documents, creating the survey, assessing the survey results. And then because of our contract with our family-to-family organization, we were able to then pull family members from a list of families that have gone through our original trainings as family leaders. And then we were able to provide compensation for those families to attend this training, which helped more with just them being able to attend and not be so costly for them. And then in regards to our Title V national performance measures, the block grant requires that we create new opportunities for engaging our families and consumers as partners in anything we do in Arizona. And so Dawn and I have been working on this for almost 5 years of how do we create a learning community and how do we create trainings where we can train families to go back into their communities, because we have rural, very rural, remote areas, and then the metro areas, and how do we train them to be able to go back out and work with families in their communities so they are part of the policy and decision making that affects them and their families. So that part is the family engagement part of the Title V requirements. The other requirement is that we have 2 national performance measures that we use this training to meet those performance measures. One of the performance measures was to the percent of children with and without special health care needs having a medical home. And as Dr. Antonelli said, this met part of that medical home requirement to have this training. And the other national performance measure was the percent of adolescents with and without special health care needs who receive services necessary to make transition to adult health care. And we really feel that this training will help physicians to understand how do they begin to work with families and youth to know their health care needs and what they need to be ready for when they graduate or turn 18 and go into the adult health care world.
That's great, Kathy. Thank you so much for sharing. Wendy, from a clinician perspective, what were some of the most valuable insights you gathered from the training that other pediatricians may want to know?
I think that we all sort of get so busy in the clinical medicine and sort of all are sort of dealing with the same issues in terms of trying to provide less fragmented care. That the thing that I learned was so important is actually the importance of getting together to have this conversation. The curriculum sort of allowed us to get all the people who are sort of doing this work in their own kind of sort of clinical silos. It allowed us to have a conversation together. And so just sort of sitting in our small groups and coming up with solutions was super inspiring. And that was one of the most valuable insights, to sort of just get us out of our typical roles, get into a space where we can have some time to discuss how can we improve and provide more integrated care and less fragmentation. That was super valuable.
Great, thanks so much. Now for the Arizona team, what are some barriers and challenges you encountered during the training, and what strategies did you use to overcome these barriers and challenges? And then as a second part to that question, do you feel there are any potential areas for improvement for this work in the future?
So I'll start. This is Wendy Bernatovich again from Phoenix Children's Hospital. So barriers and challenges, I think we all sort of suffer from some of the similar barriers of time challenges. In addition, I think from a clinical perspective, what I'm challenged with a lot is the technical challenge of sort of if we're going to change our workflow, how does that work within the environment within which we work with our electronic health record and stuff. So again, I feel like getting into that room and having a discussion with people who all know what their barriers are allowed us to problem solve and really figure out, okay, this is really important for your organization. Let's see if we can actually provide that for you. We didn't even know that was important to you. We can provide that. That's not very difficult, but this is what we really need. And they would say, okay, well, this is how we can provide that to you. So I feel, again, coming together was really so helpful in even breaking down those barriers.
And this is Kathy. I think for me, what we learned from this was that we needed to reduce our modules, take it in smaller modules when we train, not to try to do everything in one training, because you're just not, no one can take it in that well. And so one of the things we've learned from it is to do trainings in smaller modules.
And this is Dawn Bailey. I think definitely, like Dr. Wendy had mentioned, time, and then I think also just figuring out, funding to keep this going and how we can keep this work moving forward. Another thing I think is we can gain a lot of interest and excitement early on, but keeping our stakeholder group engaged and excited to stay involved. So I think we've been very mindful of trying to stay connected with them, keeping reminders to them and building that interest leading up to the conference, but then also after, and making sure that they know that this work will definitely continue. And then I think for improvements going forward, from my perspective, I think it's just continuing to build my comfort in adapting the curriculum and being very intentional to keep it functional for how our systems here in Arizona are working and as they continue to evolve as well.
Great, thank you so much. And just one final question. What is one key take-home message that you would want to share with other organizations looking to implement this training?
I'll start here. So this is Wendy Bernatovich again. I would say that I think that it can sometimes feel really overwhelming, right? You feel like care coordinating, that you're sort of doing all the work, and I think the families kind of feel the same way, and the organizations and the community feel the same way. I think that one take-home message I would say is that really working synergistically with your family groups and your Title V organization has really allowed me to kind of continue my really busy clinical practice, but continue this conversation going forward. This is not something that I can do on my own. So realizing that other people are really very interested in this and really engaging families has been a huge bonus here.
And this is Dawn Bailey. I'll kind of add to that, too, with the family. I think from a family perspective, a takeaway message is that a lot of times we talk a lot about the issues or gaps that affect our families, and we don't always see opportunities to really do something to change that. And so I think this curriculum has allowed us the opportunity to come together, and like Wendy said, having the partnership that we have with her from the clinical side and then myself from the family and Kathy helping to support through the public health and Title V is that we've really been able to now be intentional on how do we really use something to actually make changes instead of just always talking about the issues or ideas. And then, again, with the family perspective, I think just ensuring in this work that family representation is there. I'm so grateful that I am, have the opportunity to participate in this as an equal member of the team and being able to be part of the facilitation of the curriculum. And I think that is very key in anybody else who might be looking to do this curriculum is ensuring that family representation is an equal representation, and then absolutely making sure that families and patients are really part of the training and highlighting that role, because this is who we are doing this work to benefit.
And I think for me, this is Kathy, one of the key take-home messages is relationship building. I feel that what we've learned over the past few years is that the connections that people have with each other is because of their relationships. That's how we're getting things done for our families. And I think we need to build stronger relationships among the key partners so that we can continue to look at the issues and resolve the issues that come about with trying to coordinate the care for our kids.
Great. Thank you all so much. A big thank you to our Arizona partners and our partners at the National Center for Care Coordination Technical Assistance team for taking the time to join us today and share your fantastic work with us. For more information on practical tools, resources, and strategies on how to complete a similar care coordination training, please visit the National Resource Center website at www.medicalhomeinfo.org and click on Promising Practices.